Hi, welcome to the 31st case. Today is Wednesday, the 7th of May, and I'm going to talk about diffuse cystic lung disease with abnormal lung parenchyma. So, the 60-year-old known to have Sjogren's disease presented for a follow-up CT, and you can see multiple cysts throughout the lung parenchyma representing diffuse cystic lung disease. And if you remember, about a few days ago, I did this post, and I'll put up the link at the end. And this was just about so maybe about 10 or 12 days ago. This patient had LAM. But our patient today has diffuse cystic lung disease with abnormal intervening lung parenchyma. So we've got, reticular opacities, traction bronchiectasis, as you can see here. There's intervening ground glass. So there is an interstitial lung disease accompanying the diffuse cystic lung disease. And there is this whole talk on practical approach to diffuse cystic lung disease, which is available for viewing on YouTube. And again, I'll put up the link at the top right and at the end. And here's a chart. And in the chart, you'll see that if you have cysts with nodules or cysts with other findings, then LIP is the common entity here. But in the setting of Sjogren's disease, the moment we have a combination of cysts and interstitial lung disease, that would represent lymphoid interstitial pneumonia or LIP. And coincidentally, this was about 2 months ago that I did a case at ctchestreview.com on Sjogren's disease with ILD, and it was the same patient but from last year's scan. And again, I have the YouTube link, and all of that is available for viewing. So you'll see the link and you can go through it. But the reason for today's scan or yesterday's scan, which I saw today, was to check for stability, progression, regression, and the disease is absolutely stable. There's no change in the cysts, in the interstitial lung disease, etc. And everything has remained stable for a year. So this almost seems like extra homework. So instead of talking about Sjogren's and LIP here, I've given you two links of two other videos where I've done this in detail earlier, so I didn't want to make this repetitive. So maybe whenever you have time, you can go through all of these. That's the WhatsApp channel. Thank you for viewing this.